Now I can see you. Thank you again for being with us today. I'm really looking forward to this session. It's about help or hinder, the impact of state and federal policy on our COVID response. And our first guest that's going to join us is Senator Fred Mills. He's a licensed pharmacist and has served as the executive director for the Louisiana Board of Pharmacy. Senator Mills brings a sense of decency and intelligence to the public discussion on how we can best care for Louisiana's most vulnerable. To me, he's a friend, he's a colleague, and someone you can depend on to represent your interest. He's someone you can trust when you need an advocate. Please join me in welcoming Senator Fred Mills. The COVID days.
Good to see
you. You too.
Am I on, y'all?
I think you're on.
Good morning, everybody. Y'all okay with me taking my mask off? It's okay. First of all, thank you for having me. It's an absolute pleasure, and it's always a great, fun time to be with Jan. I guess I'll just start it off that Jan called a couple of weeks ago, and we started talking about certain things. We maybe wanted to recap of what we did last legislative session, COVID-19 policies, and how it affected the Health and Welfare Committee, which I'm chairman of. And from that conversation, things really have evolved into maybe something else I need to talk about at the first part. And that's where the legislature will be called into session on Monday at 6 o'clock. And the legislature has called themselves in session, not the governor calling us in, but the legislature. And I think a key point from the healthcare perspective is going to be basically one of the things. I think there's a group of legislators that basically want to open things up totally. And what they've been having is a petition out there that basically says that the governor's emergency powers would be revoked. And basically everything kind of opens back up, and it kind of comes back to the parishes to decide. There's a group of legislators that have said, no, that's not right. The governor is doing the right thing, and we totally support what he's doing from an emergency perspective. I think that is going to be a huge debate in the next couple of weeks, and I think you're going to see a lot of emotions versus science. I think you're going to see a lot of business interest versus the medical interest. I think you're going to see a tug-of-war between what the hospitals say that would happen from a capacity issue versus people are saying, you know, I can't make payroll because I'm working at a 25% capacity level. So I think you are going to see a tremendous amount of discourse, and you're going to see basically arguments on all sides. But for today, I guess we'll be talking more about COVID-19 policies. And from the standpoint that I've been seeing, I'm chairman of the Senate Health and Welfare Committee. And in the last legislative session, we as a committee made a decision that unless something was really timely and it needed to be acted on, that we decided not to have any legislation presented to our committee from the Senate side. We had 38 bills that had been filed. 18 legislators filed it and said, you know what, if we file this legislation and the Health and Welfare Committee has certain issues to discuss, it's not fair for the public not to be able to be there. And there were several issues that it concerned the nursing profession. And I was getting calls from nurses throughout the state of Louisiana saying, some of this will affect my profession, and I don't even have the capacity to be to Baton Rouge because there's so much going on. Now, this is in March. So just the backdrop, Jan, I'd like to lay for you is that you're going to see from a policy standpoint a really, really polarized debate. And we can talk more about it, but yeah. I just kind of wanted to set the table here.
Yeah. I know when we spoke, you said that really during the session there was money pouring into the state, but y'all were really focused on directing the money appropriately. But the opportunity for the public input was just not there for many reasons, and it makes it tough to lead like that when you don't get to hear from your constituents.
That's a great point. And you know, probably 40% of the 144 legislative members are new members. Mm-hmm. They've never been in the process. So still to this day, they've not seen a true debate in a committee hearing that has the input of all of the citizens and their special needs or their special interests. So it's a different dynamic because we've never had a normal session with the new legislators.
Right, and you can't vote by Zoom.
No, you can't vote by Zoom, and what really troubled me was so many tough issues. If we don't have the public input, something is truly missing.
Yeah.
It really is.
I agree. Why don't we welcome Dr. Stefanski to join us? And let me get my notes here. Dr. Tina Stefanski is the Regional Medical Director for the Louisiana Department of Health in Acadiana. A Crowley native, she graduated from LSU Medical School and completed her residency in pediatrics. She's worked with the State of Louisiana Office of Public Health for the last 19 years. And as most of you know, she's been the voice of reason in Acadiana on how to manage and protect our health during this COVID pandemic. Dr. Stefanski, if you'll please join us.
Thank you. Good morning.
Yeah, thanks for being here today.
Appreciate being here.
We did a
Opportunity to be here.
podcast actually together, and we did it by phone.
Yes.
And I just prefer in person so much, even though we're a little bit afar, away from each other. I want to thank you for all the time you take, and if you can share with us what's been going on.
Sure, yes. Well, it's an honor to be here with all of you and to be on a panel with Senator Mills. I don't think the people of this region and certainly the state realize how fortunate we are to have someone of his intelligence and empathy and ability to reason. And so I personally think in this next session they need to vote to allow you to serve in perpetuity. Perpetuity. We need you to remain in the legislature. Again, I appreciate the opportunity to be here and really, start off by thanking the healthcare professionals that are joining us, the members of the public, for all of their work over the last several months. We wouldn't be in the position that we're in today without the support and work of all of of this community and the people of this state, certainly our leaders, but also the general public. It's, I certainly understand that, asking people to really maintain these measures. So, it's not natural to us. Wearing face coverings aren't natural. We're people who like to get together. So not being able to congregate as we normally would, not being able to see members of your family, particularly those at high risk, are not easy things to do, and acknowledge that. And so I appreciate the opportunity to thank people for that work, because I feel like over these last several months was always, at a microphone talking about what we needed to do and how bad things could get. And so I'm happy to say that things are better, and you probably heard that on the last panel, that we're in a much better position that we were in, but it's not. But it's because of our, state and local leaders and the work of the public that we are where we are today.
Right. The last panel were all three doctors, and without fail, they emphasized the importance of keeping the mask on. And Dr. Stefanski, you've been preaching that.
Yes.
Do you feel like sometimes you need to hit us over the head with a 2x4 to drive those points home from a public health perspective?
Yes, certainly. And if you look at the graphs, if you look at our epi curves where we track and monitor cases over time, there is absolutely no doubt that the mask mandate has made a difference. And so again, when you track cases, we know that it's not reasonable to ask people to stay at home. Certainly that's effective, right? But that's not reasonable on many levels. It's not good for people's mental health. It's not good for their physical health. You saw Senator Cassidy say people often neglected other health issues, chronic health issues, because they were concerned about going to see a healthcare provider. So it's not good, certainly for the economy. So stay at home can't be something, is not something that's acceptable. So if we do want to continue to move forward, we're going to have to continue to do things like wear a mask, keep your hands clean, avoid big groups of people, and just being more careful and cautious over the next several months.
I'm curious, Senator Mills, when the legislation or when the legislators meet, I know you work closely with Dr. Stefanski. Is she going to be one of the witnesses that have to talk about the importance of keeping the mask mandate in place?
I hope not.
How do you interact? How do your offices interact between the Senate and the Department of Health?
Jan, that's a great question, and I want to take this opportunity on behalf of all of Acadiana to thank Dr. Stefanski. You just would not realize the work that she's doing behind the scenes, because without her, we wouldn't be in this position. And from Dr. Stefanski's standpoint, she's juggling not only COVID-19, but when she sees me calling, she must say, it's him again, because I'm either calling about a water quality issue, I'm calling about a sewer issue, I'm calling about a permit. So you have that day-to-day work that the department still has to do, which is, it's amazing what they regulate. But on top of that, you have the whole COVID-19 piece. Jen, you're right. We are going to have to bring in statistical information. We're going to have to bring in real data. And we are going to have to bring in healthcare experts, because what I think the debate is falling upon is, yes, we do have the economic debate, and I'm president of a bank, so my phone rings all day long of people saying, listen, I need a moratorium on my loan. I've been paying you guys out for the last 20 years. I'm at 25% capacity. I can't make a profit. So we're balancing that, and that's going to be where the debate's at. In my thoughts, what I'm hoping to see is the people that do this day to day saying, here's the facts. Now, can we balance, as Dr. Stefanski said, can we balance the economic portion with the healthcare portion? I feel we can. But we just can't lose that discipline that
Right.
the virus doesn't have a timeline.
Right.
No, and it's also, it's a new virus. It's a pandemic. It's affecting the whole world, and we're all learning as we go. And so just as you might have heard from healthcare providers earlier on, that the treatment of the acute illness evolved over time. And so our physicians, our nurses are much better now at treating acute illness. So someone who, especially those who are hospitalized and acutely ill, we've learned a lot about treatment, but there's still trials ongoing. So we still are working, on what are the best ways to treat this virus. But similarly, what are the interventions, these we call non-pharmaceutical interventions, that the community needs to take in order to prevent or damper the spread of the virus. And there may not be a whole lot of evidence-based studies to prove that yet, because we're all learning again together. And so I do fear, or I'm concerned, that those individuals who are going to be on the kind of the extreme end, the other extreme, and want to open everything back up with no restrictions, no breaks, to say, prove to us why we can't do this and why this wouldn't be a good thing. I think you're not going to find a whole lot of studies or evidence, because again we're learning, and so is the whole world. And so I would caution the public, while usually in medicine and science we say, let's look at evidence-based studies, let's study this and prove, why are we making these decisions. In some cases, there may not be a whole lot of great evidence other than what we've been through before. And so I can tell you, so in our Acadiana region, the first wave, although we've never really probably gotten out of that first wave, we saw, when you compared us to New Orleans or the Houma Thibodeau area, or even some of the northern parts of the state, we had a little bit of a bump, but we did not see those big increases in cases in the spring. However, we know over the summer, see that big increase. Our hospitals were really at capacity, and we had lots of people hospitalized and severely ill, and an increase in deaths. And we know that people were getting together. We know that the bars were a big driving factor in our community of that. And not to pick on any one industry, but just people getting together in crowds and lowered inhibitions. And so as we are trying to do things more slowly and right this time, I really do hope that people recognize that your actions right now are going to affect where this community can be economically in the next month or two. That if we don't continue to take things slow, while we may not have these great evidence-based studies, we certainly know what happened.
Right.
And Jen, one thought that's really interesting from kind of the political standpoint, and I think Dr. Stefanski can expand on it, but many of the calls and emails I get from constituents are basically questioning the actions of government and what's taking place, and it's maybe too restrictive, or why are you doing that, and there's a disconnect. But what's really interesting is right in March, the President's task force came up with a document called Open Up America Again. And in that document, it details, what do you do in phase 1? What do you do in phase 2? What do you do in phase 3? And Louisiana and the healthcare experts in the governor's office have been following that really to the T. And Dr. Stefanski may talk more about it, because she met with Dr. Deborah Burks.
Yeah.
And they had those conversations. But when I tell constituents that we're pretty much following the federal guidelines of the Trump administration, I find the politics gets real crazy. It's kind of like, so a Democratic governor's following what a Republican administration's doing. I said, yeah, they're following it to the T. Yeah. And I find the public is kind of like, well, I wish I knew more of that. And we've been trying to just message from our office when I get calls is, here's the guidelines. They were developed in March, and the state is in a very methodical, disciplined way following it. And Tina may expand on it, Jan, to talk about your meeting with Dr. Burks, because I thought that was interesting.
Yeah.
that type of situation.
Yeah, it was wonderful. I mean, that was definitely a highlight of these last several months was the opportunity to meet. We had a great meeting with hospital representatives, private health care providers, Dr. Burks, the governor, of course, our wonderful secretary of LDH, Dr. Phillips, and she praised Louisiana, praised the governor for following their guidance to a T, for frequent communications. And she mentioned that on the calls, our governor is often the voice of reason. And they were just, again, could not be more complimentary and about the fact that we as a state were following their guidance as intended. And so I do think that, like Fred said, probably a lot of people, I suspect a lot of people don't realize that. And it's all, we're all working towards the same goal. And so hopefully politics, won't be something considered when people are thinking about what should or shouldn't happen in this next session, because it's science. And again, if we follow the guidance of the best health experts and scientists, then that's all we really should or could be doing.
I'm glad the politics came up because you were reading my mind. And I laugh, Dr. Stefanski, when you took your oath, it wasn't, I promise to do no harm to Democrats or to Republicans, but this has become a political football. And from a physician standpoint and a pharmacist standpoint, you don't ask people when you treat them, how did you vote last time? You don't ask them anything except what are your symptoms? How can I help you? And we're supposed to be talking about policy, but this digs so much deeper into some of us are hard-headed about who are we going to believe. And I think that's what I'm fearful of. I want to get into other policy, but with this session coming up, Louisiana is now one of the top states as far as the low level of infections, aren't we? We were
Yes.
Actually kind of brought out, saying, look at Louisiana, what they're doing, because we've been following the guidelines, and we could lose that so quickly.
Yeah, and I think it's great, I think leadership at the state level is so important because consistently, if across the state we follow, we're all working again and moving in the same direction, and not letting each, and again, this is nothing to do with politics at all, but knowing that we're geographically, it only makes sense, right? That that we all again are working and moving in the same direction and following the same guidance. That I think that's what got us out of the situation that we were in, where, frankly, again, when you look at the curves, when you look at the hospitalizations, I was really, really concerned with our hospitalizations, with our ICU admissions, with our ventilator usage, with this last kind of wave, or really our big increase in cases. I was very, very worried, knowing that all translated to individuals and their families and the repercussions. And so I do think it gets lost on the big scale that, you take it down to the individual personal level, and there are people that are still struggling with the after effects of this virus, and so it's important not to mix those politics up with people's health and their lives and the lives of their family, and then the health of our community.
I did a podcast recently that'll be aired, I think, next week with a fellow that helps treat people with addictions and mental health issues, and the evidence is looking to be that there are a lot more suicides this year than in the past. And I don't know how this falls into policy and what you see, both of you, but are you seeing an uptick in mental health challenges? Is that something you get statistics on in your office?
So no, I guess anecdotally, certainly I've heard that, but I don't have the data, the statistics nationally. Yes, all of those things are tracked, and this is definitely and across the world. On a few different levels. I think there's actually some concern about the virus and some of the things that we're learning about longer-term effects or near-term effects. We talk about heart disease and effects on the heart and muscle, your lungs, also neurologically, that this virus has some effects that we don't quite know about. And one is on mental health and cognition. So there's that. And then there's I think the whole anxiety, it causes a lot of anxiety for all of us. And then also the disconnection and social isolation that people are feeling.
And Jan, just last week, it really came to a head from the legislative standpoint, the nursing home issue, to visit your loved ones in the nursing home. And I know the audience can probably relate to this so much, but the calls that we get as legislators is, look, I've not seen my grandmother in the nursing home since March, and we want to go and see her, and we've had enough. We just have had enough. And we had a conference call with Dr. Jimmy Guidry, the state health officer, and several healthcare experts that Dr. Stefanski works with. And I will tell you, it was one of the toughest calls we had. It was kind of like, let it all out, tell us what you got, tell us what your constituents want. And Dr. Guidry made a point. He said, listen, we are trying to balance out all of this, but I will tell you, if you go to the nursing home and you do even an outdoor visit and you hold hands with your loved ones, that spread can take off like this. And he said, I would much rather your loved one alive and go through this. And then CDC came up with the guidelines a few days later. What I saw in the call, though, I witnessed in the call, and I see in the call, it's Zoom now, so we do see each other on the call.
Yeah.
The emotions were spilling over to the standpoint that my patience level is done. I can't take these calls anymore. I can't take the pressure anymore. And from, I guess, a politician standpoint, when you have an issue that's out there, and say it's a really polarizing issue, well, you probably get half of the calls for, half of the calls against. So you can kind of judge where's the pulse of where you should go from a policy standpoint. In this phase, every call we get is anger. So you take all of that anger, all of that frustration, businesses closing, people losing their jobs, musicians not being able to entertain. And I think the key I keep trying to say is, can we balance it? And Dr. Stefanski and LDH, I feel they do an excellent job. If we follow the protocols, we follow what we all know is the things we need to do as healthcare experts, I feel we can balance it. But that's becoming it's tough to fight emotions versus science.
Senator, do you think that with COVID highlighting how our vulnerable populations, are the nursing home issue is front and center, and you read my mind again, a lot of people want to stay in their homes as they age, and they need help, and a great number of our dollars, the state dollars that are, federal dollars coming in too, go to the nursing home industry. Do you think there's an opportunity for more in-depth discussion about looking at the policy that Louisiana has and maybe moving towards people being able to stay at home?
That's a huge issue, and I've seen it. This is my 13th year on the Health and Welfare Committee, and you do have that consistent battle of funding for long-term care. We can do both, but the nursing home industry does have a purpose of certain type of situations, and home health care does have a certain type of situation. That balance, I think, will always be a battle. You'll have the economic piece that's tugging at you, and then you're going to have the other piece that's basically, I want market share, so you're going to have that discussion. But I think in the immediate look at we have right now is we can't lose our focus on protecting that vulnerable population, no matter where they're located. And I find people are saying, and it rightfully so, is if mama doesn't get a touch from me and the family, that emotional distress is also killing her. Yeah. So it is one of the toughest situations I've seen from just political calls. Because the public feels that, we can, as legislators, kind of just make a call to Dr. Stefanski and it's done, and that's not how you handle this situation. It has to be policy driven.
You're not a magician.
What's that?
You're not a magician.
No. But, we agree, and that's really been one of the toughest things over the last several months. And again, and it's back to, I know there are people who just want things to go back to normal. No one more than any of us, I'm sure. But I think it's trying to get people to reason with people and realize, the only expression I can think of is when the cat's out the bag, that's it. And so if we just don't take, this in we don't use a measured approach, then we're going to end up, we certainly could end up in a position where we're back to having to to start shutting things down and to limiting things like nursing home, visitations that are just going to get ready to open back up, or schools opening back up, or businesses thankfully being able to do more. So the nursing homes has really been one, trying to explain to people, look, what our actions, as we're all healthy people out in and about in the community, has a domino effect on the nursing homes. Because when the community, and so that's, you talk about policy, that's one of the policies. And the governor, again, they consult with the White House on all of these. But, many decisions now being made tied to this percent positivity. So, when bars can reopen in Zone Lafayette, it was wonderful. The last couple of weeks we've had a low percent positivity, and so met the governor's criteria for bars to reopen. Similarly, CMS came out with guidelines that are tied to percent positivity in a parish for nursing home visitations outside and indoors. And so nursing homes are working really hard now. And some in our area have started the outdoor visitations. Indoor will be tied to percent positivity, but it's something that we're gonna have to monitor. Our nursing homes have done a tremendous job over the last couple of months to keep that population safe, because again, we saw what happens when this virus runs through a facility of just the most vulnerable individuals.
I thought our numbers would have shot up between Hurricane Laura, Labor Day, people going back to college and all, and we are maintaining,
Yes.
a good level of numbers, but how has Hurricane Laura, if y'all can talk among yourselves, maybe affected our health industry in this region in particular, and then maybe what we can anticipate from the state helping people recover?
Yeah, so I can, we've heard from healthcare providers that, as individuals, of course, have left Lake Charles, with lots of people, who are living in this area, and then, of course, the New Orleans and Baton Rouge region. But I know our hospitals, for those individuals who are starting to come back to Lake Charles, their healthcare system isn't up at capacity, and so they are. I do think that has affected some. That has had a little bit of an effect on our healthcare system here. And just from the state perspective and the federal, there has been support of those hospitals in Lake Charles through federal DMAT teams. Dr. Guidry, who Fred talked about, is wonderful. And again, from this region, from this area of the state. And so, he's been able to get some federal assistance to help support those healthcare, that healthcare system in the Lake Charles region. But it's going to take a while to come back up, so that will have an effect here.
And on an interesting note, taking just a little detour, one of the issues that was brought out to us is that for the special session, we'll need to address the funding for education for Hurricane Laura, because many of the students are now in Texas, and so we have to address TOPS.
And here.
Yes.
Yeah, but they're out of state, is what you're
Out of
saying.
state,
Yeah.
and so out of state, there's some funding issues. There's some issues that we have to look at. There's some issues if they would graduate in Texas, how it would affect TOPS. So there's several issues there. I know from talking to Dr. Guidry, and Dr. Stefanski knows this much better than me, is that I think the jury is still out with so many people living in hotel settings, living in the New Orleans area. And then I guess another issue too, I know Dr. Stefanski could probably expand on, is kind of what is the prediction coming up for the fall with flu season? Right. And also just from the standpoint of, I think, and so much of this audience can probably attest to it, just the wellness checkups, the taking care of yourself for routine visits. I think all of that Hurricane Laura, with so many people displaced and people needing surgeries that aren't maybe timely, but they'll be needed, I guess that would probably compound things, wouldn't you say, Don?
Yeah, definitely. And to go back to your question about Labor Day, same for us. We're monitoring, of course, all the time, but are looking for that big bump in Labor Day, and schools getting, coming back together. UL being back in, students being back on campus, and we haven't seen the big increases. And I really do think people in this community have, and when I talk to my counterparts across the state, it's not the same across the state. I do think people in this community have really remained faithful to wearing of masks and trying to be just a little bit more careful as we go out and about in public. And so I think if we can, again, not to beat a dead horse here, but if we can keep, I think once people see the benefit of an action, I'm hoping that will help to give us some evidence to continue this moving forward. And then, as Fred said, again, not a problem unique to us, but there were a lot of people who neglected their health. through this pandemic. And so we do want, and you probably heard that from Dr. Kaufman, in addition to surgeries that had to be canceled because the healthcare system couldn't handle that capacity, including people who had cancer, whose surgeries had to be delayed if they weren't necessarily timely. Similarly, people with diabetes, hypertension, frankly in many cases, waited too long because they were scared or concerned about going to see their physician. Senator Cassidy talked about telemedicine. I mean, that's really been wonderful. But there are some things that people need to do in person, and we want to make sure that that's
And a good point with a big issue I think is going to come about as telemedicine, and it may be of interest to the audience, but as telemedicine becomes more popular, a major issue nationwide is becoming parity of payment. And it's almost the standpoint that if it becomes more of a norm that a provider is paid equally to a regular visit, I think that's going to be a major issue that I think the healthcare profession probably needs to tackle. I met with the Medical Society a couple of weeks ago on a Zoom call, and I said that I think is kind of a prediction out there where the insurance carrier may say, well, here's a 50% reduction because it was telemedicine, and here's what you get for a home visit. So I think as it always comes about, money will probably be an issue to talk about.
Right. So during the early days of the COVID pandemic, I don't know where it is now, rules were suspended and telehealth visits were covered the same as in person. Where are they now, though? Are insurance companies not providing that? Do you know?
I'm not sure about the payment.
I'm not sure, but what I've heard, I've been on some national calls with the National Association of State Legislators, and they say that this is going to become a big issue that I think right now, because we're in a national emergency, that there's some relaxations of payment. But I think what I'm hearing is down the road, the insurance companies may deal with that, where I think the providers need to be on target to know that that could be an economic debate.
And just thinking about it practically, when you're a provider, you're not going to, if you only get paid 50%, you're not just 50% liable if there's a problem with the patient. I mean, you're 100% there providing health care, which could be healthier than somebody driving to the office, being exposed to others. Or exposing others to what they have.
And a big issue, as we kind of just kicking a lot of issues around with COVID-19 from the healthcare perspective to the economic perspective, many physicians, many rural hospitals, because elective surgeries and because primary care wasn't delivered, a lot of these physicians and healthcare providers, their economic stream was really in a tough situation. So it's been an issue where I'm not sure full recovery has been there. You do have the PPP loans, you have those issues out there, but there's more than just certain facets of the economy that's been affected. It's also been the healthcare arena in some aspects.
And especially in Southwest Louisiana, I'm thinking of a personal story. My niece is a dentist, so they were closed for most of the past few months, had just really reopened, getting back on track, and then the hurricane came through. Her office is pretty much destroyed. Equipment's going to have to be replaced. And I don't know how people are going to bounce back, but we always seem to. We seem to have that spirit to bounce back.
And then the other issue, I think, is business owners and people that have healthcare practices. We still can't relax because you get a COVID outbreak in your office practice or in your pharmacy or in your clinic or whatever, and you lost your payroll. I mean, you lost your people that take care of the services day to day.
We spoke in the last panel about vaccines, and Lafayette General is going to be rolling out a trial with Ochsner and the desire to get this. Even if it's effective, they're saying it might be 50%. Nobody knows yet. But Senator Mills had brought up something with me, Dr. Stefanski, when we were preparing, and you said that there might be some legislation looked at because I don't know who is legally able to give shots. I know you can get some shots at the pharmacy, but this COVID vaccine, if we get it, we need to roll it out quickly, and it can't be handled by just doctors' offices and a few providers, right?
Right, and I'll let Dr. Stefanski be my safety net.
Is this a hot button?
Yeah. But I guess from the legislative standpoint, we have always, and a lot of this started with H1N1. When H1N1, we didn't know what we had to mobilize. Dr. Jimmy Guidry, the state health officer, called me up and he said, listen, are pharmacists and other professions ready to give immunizations? I said, yes, they've all been in training and they work under a collaborative practice type agreement. But to have individual authority, at that time, it wasn't existent. So he became very creative, and we opened up the spigots to allow more people to be able to give immunizations. What I have talked about with Louisiana Department of Health is that maybe we should, and we're looking at it right now, is give the agency more authority, that if they need to promulgate rules and regulations to make this specific to COVID-19 vaccinations, that certain maybe healthcare disciplines would be allowed to do certain things that are above and beyond their practice act, and maybe to have a little bit more independence. So that's something that we're probably going to be bringing out during the session, but it'll be kind of ironic to talk about it, to give the administrative arm of government more authority where there's a session to take away that authority. So we'll kind of talk about that policy, but I think Dr. Stefanski can probably talk more into that issue.
Sure, and so, you know, that's something that we do in public health is plan for distribution of, if we do have a pandemic or some other type of disaster, for the rapid distribution of an antiviral or an antibiotic or vaccine. And so those are plans that are always in the works, but when we talk about a vaccine, you can imagine how much more challenging that is to administer than an antibiotic or an antiviral that's, you know, in a pill form and in a bottle. And so I do think we're going to have to be more creative and innovative because of course we're going to want to rapidly deploy whatever once we get a supply that's available and enough supply to administer to the community.
You think it's going to be a shot or a pill? Does anybody know?
It's a vaccine. It would be.
It has to be a shot.
Yeah. I mean, the formulations that I'm aware of at this point are.
I don't like shots.
And then I've seen it year in and year out. When you do expand this opportunity, you are going to see a coalition of anti-vaccine folks.
Oh, yeah.
They're very mobile and they are very vocal, and it's going to be another issue of the science isn't proven, the studies haven't been done, so you'll see a lot of that in the media.
May I piggyback on that? Speaking of vaccines, are you seeing a decline in children getting vaccinated?
Yes.
Like what's going on outside of this COVID stuff? Are people getting leery of vaccines?
Well, not so much that, but as we talked about, you know, people not wanting to access healthcare in person as much. That has been true for childhood immunizations as well. And so, you know, concerns, because it's, again, not just in the United States, this is worldwide. Again, it's, you know, they're great initiatives, you know, the Rotary Club, for example, these big polio, you know, helping to eliminate polio. So across the world, we're seeing a decrease in these routine immunizations, and that has got to quickly ramp back up because, you know, we're dealing with COVID right now, but we certainly know there are still these vaccine-preventable illnesses do still circulate more in other, you know, not so much in the United States where we have high immunization rates. So, so it is, you know, we really are working to try to get, you know, people back on track with vaccinations. And so school is another place. It's required for school entry in the state of Louisiana that a child be vaccinated and up to date on their immunizations. And so, you know, we know schools have been, you know, just kind of getting back, focusing on COVID. And so this is something that, as we're working to try to figure out flu vaccinations and COVID vaccinations, maybe in the spring or summer, we also need to really push the routine immunizations for children.
Yeah, we've all been in hiding. I guess it's so easy to become lax in all of your health care, dental, everything. If you're not going out, you're not thinking like you would when you were just operating out in the world, you know.
Yeah, you know, we don't remember, thankfully, polio, but you know, my parents do. So that's a disease that still circulates in other parts of the world. And so I'm just choosing one, but you know, there are several. We still, of course, measles, mumps, rubella, pertussis. Those are diseases that occur in other parts of the world. We've been fortunate here. We don't see huge numbers of cases, certainly not polio. We have not seen those cases here, but we do occasionally see little outbreaks or clusters of things like measles or mumps. And those are very real threats to the world if we don't, you know, kind of quickly pull together and step that up.
Dr. Stefanski, I know that the Department of Health does a lot more outside of COVID. And when we were preparing, water quality came up. And if you would explain, you do a lot more than just making sure people are wearing their mask. I mean, the big overview of your department and maybe we can touch on water quality issues, because I think we've got some real problems in our state.
Sure. So, in the Louisiana Department of Health, we're an office under the department, the Office of Public Health, and so we've got this personal health side, so our health units, and so thanks to the taxpayers who greatly support the operations of our parish health units. We have our infectious disease and epidemiologists. That's kind of what you're thinking of with COVID, and then environmentally, our sanitarians inspect the restaurants that we eat in. Up to quarterly, just depends on on the numbers of individuals served through those restaurants, cafeterias, jails. We inspect all of those entities, but we also monitor drinking water. And so the EPA it's a safe drinking water program. So we monitor, we follow the EPA's guidelines for chemical contamination in your drinking water. So there's a schedule where we either sample or have to, be assured that the system has sampled, and so we sample for chemical contamination, and then also for bacterial contamination, and that's done, of course, more routinely on a monthly basis. So yes, and so if there's a concern with a chemical or an element in the drinking water, we have to notify the drinking water system. Senator Mills is intimately aware of these issues, and so we work with constituents. With his constituents, with the general public all of the time, and so we have community water systems. In Lafayette, we've got LUS. You have people who live in mobile home parks. They may have a smaller community system, and so we have people who have individual water wells, and so we don't monitor those. So it's definitely a whole nother, as you said, function of our agency, but a really, really important one.
Poor Dr. Stefanski, I'm telling you, every time she sees my phone, it's about a water system. And we've had some behind-the-scenes meetings with angry residents of their water systems, and that's one of the biggest calls. And just to highlight that, I had a piece of legislation this session that I decided not to do because of COVID-19, but I really think we should have our water systems graded with a letter grade,
so
just like our school system. So if you get a notice that your water system got an F, there's different issues out there. And that's something I'm going to run with. But this is amazing, Jan. An independent engineer's report, engineering study shows from the last legislative audit that our entire water system infrastructure is rated a D-.
And why is that? Can you explain what they're looking at?
They have certain criteria, and Dr. Stefanski may know more about it, but I think it's the pipes and the testing and the aging of it and everything there. But just to get it from a D- to an acceptable level is a pin-up cost of over $5 billion. $5 billion. And I will tell you, there are so many water systems right now that are so old, and their infrastructure and their pumps and their whole system is so old. Dr. Stefanski and her team do as good a job as they can, but sometimes you're really putting a Band-Aid on something that has a cost that's so grave that you can't pass that on to your people that use the water system. So there's federal money, there's state money involved, but I would say this is going to be one of the biggest issues we'll be talking about for years is water quality.
And it's like, it's not blindsiding us, but I was listening to the radio the other day, and Aaron Brockovich was on Jim Inkster's show on Talk Louisiana, and I didn't realize this was a big issue for us. We've been so focused on the pandemic, but we all know, like, whoever thought we'd be relying on bottled water when we were growing up, to have to buy water in a bottle. But what are we going to do? And people that don't have means, they're probably in the worst situations.
It's a huge issue. But I think the first issue is we have to bring it to the forefront. And I don't know how many of the audience gets one of those reports that maybe from the department that says, here's how many micrograms of this you got, and it's hard to understand that report. But everybody understands the way we grade our school systems. You understand an A-performing school and you understand an F-performing school. I truly believe that more transparency has to come to the homeowner to understand that at the end of the year, your system was graded an A, and that's great. But if your system's an F, here's the criteria for the F. And I think when the public sees that, it's going to demand a correction to it.
And it's not just us, it's nationally, right? It's probably an international problem. But
I don't know other states, but we are a D-.
Yeah.
And so, I want the public to know and to not panic, I guess, over this, because we do, if there's, we have levels of, there's so many chemicals that we monitor, and there's treatment. So if you, and this is an element, so this is where you need our engineers, and so I'm not going to talk a whole lot about the details because, again, I'm definitely not qualified to do that. But based on, so the EPA, we kind of have tiers of concern, right? And so if it rises to really, if there's really a significant, a known health concern, then the public or the individuals on that system are notified. And so if you haven't gotten that notice, we don't, and that doesn't happen often. We've been pretty fortunate. What it normally is kind of a push and pull between our engineers and the drinking water systems, looking at reports and what elements maybe that we need, that system could then treat to help reduce that risk of exposure to individuals. And so it's, our engineers are on their A game. I mean, they're wonderful. It's a big part of the job that we do in public health is monitoring and ensuring that the drinking water that we've got is safe. But as Senator Mills said, at some point, these systems, we've got some aging systems, and so it's going to be costly, but it is something that we should all really be interested in concerned
So between
about.
COVID-19, polio, drinking water, I have complimentary Prozac for all of the audience.
Thank
when we leave. We all going to take a Prozac and go home and
From
just
Cashway Pharmacy.
quit it. Sorry,
But-
Jan.
And I really, so, I do think, hopefully people take away from this that the role of government is important. And so, we need to have some entity, when talking about drinking water, who has no stake in the game other than to make sure that that the water that we drink
Right.
is safe and healthy. So,
Right. I'm
so-
thinking when people get a call, this is the government, and I'm here
Exactly.
to help you. Nobody's really that excited, but boy, do we depend on you guys. We can't fix this. Like a consumer on our own, we cannot fix the water system.
There was a neighborhood in this area that after a big rain, the water system was totally messed up and sewer was coming out of people's tubs.
Oh, God.
And that's when you want some government.
Yeah.
You want some government.
Now.
When sewer's coming out of your tub, you want government. And that's where immediately I called Dr. Stefanski, and we get a team of her engineers together. We get the people that maybe own the system. We get the people that use the water system, and we have a pretty tough meeting, and they demand corrective action.
Yeah.
They do a fabulous job, but I always tell people, you want some government in that situation.
Yeah. After Hurricane Laura and Lake Charles again, some people were getting their lights back on, but the water was, it's still an issue. And so you can't live in a community if you don't have safe or accessible water. And talk about not even washing your hands, but just having to boil everything to bathe. It's, we take all this for granted.
Yes, we do.
What was told to me, and Dr. Stefanski can maybe back that up, but in some of the smaller rural areas that were highly affected from the hurricane, that they don't have much resources, because we hear about the Calcasieu and Cameron a lot. The trees were uprooted in such a drastic way that the piping of the water systems were removed from the ground.
Oh, gosh.
So not only do they have to get their pumps and system back, the infrastructure has to be rebuilt. So it's
gonna
pretty
take a while.
tough.
Yeah, absolutely.
You don't go into Southwest. You're not in Calcasieu.
No.
Your region.
Acadiana, so really Acadia Parish
Yeah.
is far west.
Yeah.
Which happens to be where I'm from.
Right.
Not to mention
I forgot
Acadia.
the Stefanski family in Crowley, yeah. We've got a few minutes. Is there something you'd like to ask each other that you were curious that we might talk about? Can I put you on the spot?
Well, I would just like to ask Senator Mills to stay in his position, but I know he can't.
I guess pretty much not ask, but I guess, Tina, why don't you, because I think this would be interesting, why don't you talk about some of the calls you get, not COVID-19 related, but some of the vast array of topics that hit your department. I think it's really interesting. I see it as a legislator, and I was just amazed at the calls I would get that came across your department and the skill set that your people have. Why don't you talk a little bit about, in a typical non-COVID day, what's some of the issues that your department tackles?
Sure, I certainly think environmental, those are some of the toughest, the environmental concerns. People who live in a community or in a neighborhood, and the sewer system, for example, was really not up to par. And the developer left, and these people are sitting there struggling and trying to figure out, I mean, as you said, when you have sewer coming up through surfaces in your home, that's a huge problem. And so that's one. That again takes a lot of work, a lot of effort. That's when, over the years we've worked with Lafayette Consolidated Government. Just thinking of a few examples, and they've actually had to take over systems, sewer systems, to try to get things up to par and help a community. But all of that does not happen quickly. There's a big process to that. I think TB is another issue. We take a lot of this for granted, and like Senator Mills said, I hate to talk about all these things that we don't want to depress y'all, but I guess hopefully that there is actually work and people looking to for the greater interests. So working with TB patients or people who aren't compliant with their medication, and what they do affects the community. And again, working with providers, with physicians, with hospitals, to make sure that it takes a village with some of these issues to make sure that that one person is cared for and taking their medication and doing what they need to do, so that it then protects all of us. It's it's very interesting when people evacuate for a disaster. We track all of those kinds of things to make sure that those patients are accounted for, have the medication that they need, and that we're actually witnessing them taking their medication. Those are some of the things that I think people don't think about or realize. For mold, people concerned about mold in a school or in a community. A place where the community might visit, and they're worried about their exposures. Mm-hmm. So again, working with our environmental health guys.
Since you mentioned schools, and we're going to be wrapping up, your office gives guidance to the schools, right? The universities and all. I wanted to get that in, that people are given direction from your office as to how they need to operate once the schools have reopened,
a lot
besides
of guidance.
businesses.
I've never, ever talked to schools superintendent as much as we have over the last couple of weeks, and it's a good thing. And again, I'll tell you, so for example, the numbers were released yesterday, the numbers in K through 12 cases around the state, and so we were, the highest number. Right, Baton Rouge was right behind us. They had, I think, one less than us. But it's because our schools, and so I went in, and I see all these reports, and I had looked, and I had already brought it up to our epidemiologists at the state level to say, hey, look, I'm looking at these reports, and our schools are reporting better than any place else in the state. And so you see those things. So just for anyone who noticed that our numbers were bigger than other parts of the state, we have phenomenal. Our schools are really following our guidance, and same for UL. They have just been incredible and are doing a tremendous job to again keep kids and faculty as safe as they can while they're there on campus. Yeah.
This was a pleasure. Thanks for
It
having me.
was. You didn't get to tell any jokes or do any
I
of your
know.
funny
Next time we're going to get
bits.
together and we're just going to laugh, because I got all kind of jokes I can tell you and all kind of crazy stories.
He's really got some stories.
I will tell
know.
you, it was amazing the people that called me up to know where they could get Clorox to take after the interview. People that are like, T. Fred, where can I get some Clorox for COVID-19? I was there. Don't go get Clorox. Don't go get Clorox. So
just use it to clean.
Yeah, just use it to clean.
So dispel that rumor that is not effective to prevent COVID.
Thank you, healthcare professionals. There's so many of you that
Yes.
the success is because of you, and thank you so much.
Yeah.
Yes,
Did you have something else?
No, I mean, just to say the healthcare professionals who are caring for patients, it's scary.
Mm-hmm.
It's concerning for people. You don't know. I mean, it's not just COVID. I mean, but certainly with COVID, as we're still learning about transmission and presentation, people are putting their lives and their families' lives at risk when they go to work, and a provider's office or in a hospital. I mean, it really is, not to overstate. I mean, it really is a tremendous profession, and we really have a great group of healthcare providers here.
I want to thank you both. Senator Fred Mills, such a pleasure. And
Yes.
Dr. Tina Stefanski.
Thank you.
I love that we're getting to know each other better, and thank you for taking time today. And we are now going to take another short break, and we will be focusing on improving population health during and after a pandemic. So thank you all. We'll take a short break.
Thank you all.
Thank you.